Okay. Hello, it's Dr. Kilbane, and I am here with Erin, and she's going to share with us a little bit about her experience working with our team. And your family has been amazing to work with, Erin, and you have in you have an interesting background yourself. So I would love to have you just share with us what was going on with your daughter, and how old was she, and what was going on, and what kind of things had you tried before you reached out to us?
Sure. So, Amelia, I have noticed even from the time when she was an infant, we've struggled with constipation. So, um, even fresh out of the gate, it would be one of those things where the pediatrician tells you to monitor how frequently, and if they go past, a certain number of days, then that may warrant a phone call to the office. And she was my child that was always at that marker. And she was my second, so it was a different experience from my first. So that was something that I paid attention to then. And then the transition to solids, it was also a challenge for her. I also noticed a difference in just discomfort with her. And then fast forward to the time that she was 3, we really were dealing with some major constipation at that point. And we reached out to our pediatrician. And at that point, we did go see a GI specialist. And the recommendation there was for us to just use daily MiraLAX. And prior to that, we were using MiraLAX as a tool at home per our pediatrician's recommendation. And it just didn't sit right with me to continue to use something like that regularly. And the GI specialist that we saw was wonderful. I mean, he had great bedside manner. It was a good experience. It just, at the end of the day, it just didn't sit right with me for us to continue to use MiraLAX for such a long period of time. And so after we had trialed that for, and I'm even embarrassed to say it was over a year, but at this point now, better, you do better. And there are times that it's definitely appropriate and it can be used as a tool. It was just something that we didn't want to be dependent on. And I knew that there had to be a better way. And so that was whenever I had started to do some research and found out about you, and had seen a lot of great recommendations from several other local Charlotte moms that have dealt with not only constipation, but other issues. And I was really interested in the approach that they had shared with me that you and your colleagues use.
Yes. So one of the things I'd love for you to share with us, because we made nutrition changes, we did some supplements. Was it challenging for you to make these changes in your household?
Whenever we first decided that for us, we needed to trial going dairy free, it was alarming for me because that is one of my favorite foods. And also for kids, it's an easy default: mac and cheese, grilled cheese, quesadilla. And I knew that there were some different options that were out there, but I was still a little hesitant with that. So I was nervous to begin with, but that actually I found to be a much smoother transition. We found some great alternatives that we're able to use. I made the switch for our whole family just so that it would be easier and it wouldn't feel like she was being singled out, that she was the only one that has to have this special diet. So we tried to model that for everybody.
Yes. And so you were able to do it. And how quickly did you start seeing results?
Within 2 months, we saw huge results. Now, within the first couple of weeks, we saw a change, but by 2 months, we were completely off MiraLAX. With 2 months of being in the program with our dietary changes and the supplements. And I guess the only other challenge that we had with some of the supplements were just, getting my picky eater to get them down.
Yeah.
So, she's not at the point where she's able to swallow supplements. So kind of mixing them in foods and smoothies and things like that. That was probably a bigger challenge that surprised me more than the dietary changes. But after we kind of got used to it, and then we even got our other kids on board too, so that we were all trying to make sure we're making these changes that are good for our bodies. And it's not just Amelia has to take her supplements in the morning. So we got our whole family on these supplements that have been great to keep us healthy and keep us in our tummies aligned. And it's been a great experience for us.
Oh, very good. And it's because once you start seeing those results, and once she starts having those bowel movements, it's easier, right, to keep up with things for the time that we need to. And
absolutely. And knowing that it's worth it, it's worth it. because it
Yes.
is, it takes a little extra planning. There's certain places that you can't get all of the alternatives, so you have to go to multiple grocery stores sometimes. Eating out can be a little bit difficult, especially when kids don't have a huge variety of things that they were eating to begin with. So there's certainly some of those challenges, but when you're seeing the changes that were made, and we're not struggling, we don't have fear and anxiety related to going to the bathroom. We were able to, to get potty trained, because that was something else we were struggling with, is getting fully potty trained, just because of the issues that we were having with the constipation. And within that same time frame, within those first 2 months of us transitioning, we were also able to transition and be completely potty trained at that point.
Yeah, I love that. And the way I always explain this too is, right, we work together, and it can be anywhere from, 6 weeks to 6 months to really decrease that systemic inflammation. Usually it's around the 3 months where we get those good results, and we want them to last, right? Because we don't want to have to stay on a ton of supplements forever. We just want to get the gut healed so that her body will keep having a bowel movement naturally. And,
Right.
she just, you came at it with such a great conviction. And I think that makes a difference when you're making these changes in a household. And that was just a really great thing for us as we were working with you, because you knew, you just took it and you ran with it.
Well, and one thing that was important for us was the support that we got from your whole team, from the administrative assistants all the way to the whole medical team. The support that you have, it helps you to get through when times are a little bit more challenging, or if you're trying to come up with a solution for, okay, I can't get them to take this supplement if we do it this way. Are there any other options? So having that team approach and knowing that we were supported the whole entire time, and I wasn't out on an island by myself trying to navigate this, was extremely important. And we wouldn't have been able to be as successful without that.
Yeah. And it's right. It's always about the long-term roadmap and how are we going to keep this up. And one of the reasons also that I asked you to do this is because we're working to provide help for more families. And so yes, we always have our brick and mortar where people can come in, but we're also doing this online, and we're going to be doing calls where we can, work with the families. They'll be, implementing things at home. They won't actually become our patients, but we'll be able to guide them through things. And it's like, now that you've gone through it, you could see the utility of being able to get on, either once a week or once a month, so that you can talk through these things, right?
Absolutely. And I think that there are probably a lot of families, Amelia's case was pretty straightforward. I think that for us, this model would have actually probably worked really well. Now, don't get me wrong. I really enjoyed coming into the office and being a part of having that whole experience. But I think that being able to have that touch point with so many more people, especially if it's more straightforward, and then them being able to manage it on their own. And, like you mentioned before, I have a background in physical therapy. And so patient education is huge and a big part of my career that has been very important to me, and something that I've taken very seriously. And it's helped me so much to understand that what you've provided, you lay it out very easily for someone even outside of the medical field to follow, and to not feel like that they would be floundering. It was really important to have one of my favorite things, and I even mentioned this to people all the time, after every session that we had, the notes that you gave back to us were so comprehensive, because I'm a note taker to begin with, that type A, I need to make sure I'm not missing anything. And you're hearing new terms, and you're being exposed to even some new language. I want to be the person that's kind of taking the notes, but it's such a relief for me as a mom to be able to just be present in the appointment, and then have that as a resource afterwards that we were able to work from. So I think an online program will be, amazing. And then people would be able to recognize, okay, this has gotten us halfway to the finish line, but maybe, an in-person option might be better for us. But for all those other folks that can, kind of work their way through it, I think it would be an amazing resource.
Yes. Well, excellent. And that's what she's talking about is we have a scribe, right? Isabella, who's our brilliant naturopathic doctor, and she takes notes during the visit so that we have everything very organized and written down. Because we do everything in a stepwise process so that we're really, the goal is to change only one variable at a time so that if things, are improving or if we have a reaction to something, we know what they react to. So that's the kind of the structured approach, I think that is so helpful and that our
Absolutely.
families love. Awesome. So what would you say, and I think I know some of these answers, like three of the biggest benefits that you enjoyed about working with us?
One, just the teamwork aspect of things, having that multidisciplinary group. I mean, having Deb there as the pharmacist, having you, having Isabel, just having the whole crew there and having all of that input was just wonderful because, even if they weren't all in the office for our visit, they would be, that you guys would be chatting and someone would have something to add to what our experience was. So, and as a physical therapist, a multidisciplinary approach is most certainly going to be the most successful approach in all forms of healthcare. So that was probably one of my favorite things. To just the fact that we're doing so much better. We're not struggling anymore. I just felt like, there's so many things as a mom that you always feel like that you're dropping the ball on. And I was trying so hard and I still felt like my sweet baby was still struggling. And so now to be able to be on the other side of that, it's been just wonderful for our family and such a big relief
Yeah.
that we're able to do things a better way and that I can be confident that we're doing the best that we can to make sure that we're staying healthy. And then lastly, I would just say that just the support that we had, having that support throughout the whole experience was wonderful. And sometimes I'm so grateful that she's all better, but sometimes I still miss being able to have that contact. So, and then we've learned so much for our whole family, for the health of our whole family, even outside of just the issue of constipation, going through the courses that were provided through our plan and reading your book, all of those things have been just invaluable for us to be able to make sure that we're doing the best that we can for our family.
That's one, because we would talk about some of your other family members and we were really, you were able to make some great headway in your whole household. Excellent. So anything last that I didn't ask or that you want to share or advice for other families considering taking the leap into integrative and functional medicine?
I would just say that anybody that's on the fence, whenever you're able to see those changes in your child and see the positive steps forward, it is worth every ounce of your time, your money. It is an investment from the standpoint of, financially, as well as just making sure that you are making the supplement drinks every day and that you're eating the right diet, so it is an investment in that front, but it's completely worth it. And just to see your kids be healthy and hopefully by catching these things that your children are already encountering early in their life, preventing long-term problems that could arise from these things if they're not addressed.
Yeah.
So I just would encourage anybody that's on the fence, just give it a try. You'll just learn so much about health, even for your own self, that'll help you to make sure that you're modeling healthy behaviors for your kids too.
Absolutely. Awesome. Well, thank you. We appreciate you so much. And I know everybody listening appreciates your willingness to share your experience. So thank you.
You're welcome. It's my pleasure.